Hello, I'm Dr. Jason Schlenker, owner and head chiropractic sports physician of Schlenker Chiropractic and Associates. If you spend a lot of hours at the desk, you probably experience shoulder tightness or pain, neck pain, and potentially headaches associated with your long hours at the computer. Today I want to show you some stretches and exercises that may help you alleviate those symptoms. Okay, so the first exercise I'm going to show you is called the shoulder shrugging. So we're going to scoot forward into your chair, sit on the edge of your chair. I want you to sit up nice and straight. So start with your arms to hang, just hang from the glenohumeral joint, or the shoulders, excuse me. And what you're going to do is you're just going to sit up nice and straight, nice tall spine, and what you're going to do is you're going to bring your shoulders up to your ears. So I want you to do that about 15 to 20 times. So up, and then back down. Up, and then back down. And while you're doing this, I want you to find kind of the midpoint. So this is the top, and this is the bottom, and the midpoint will be kind of in here, which will take us into our next exercise. Our next exercises are called shoulder protraction and retraction. So what we're going to do is find that midpoint again between the upper and the lower of the shoulder shrugs. You're going to go forward, roll your shoulders forward, and I want you to roll your shoulders back. So stick your chest out and pull your shoulders together in the back. Again, forward, bring your shoulder blades together in the back. You're going to do that 15 to 20 times. Okay. Once you finish that, that brings us into our next exercise, which is going to be a combination of the cervical ranges of motion. So the cervical range of motion, again, you're going to sit up nice and straight in the chair. What people have done in the past, they've kind of done the combination where they roll their neck all the way around in circles. This is dangerous. It can cause potential pinching and irritation of arthritic conditions. So what we want you to do is to break that apart. Okay. So what we're going to do is we're going to break it into cervical flexion and extension, which is flexion and extension. So we're going to do this 15 to 20 times, up and down. Okay, again, sit it nice and straight. Good, then we're going to move into the lateral flexion, which is bringing your ear down to your shoulder, both sides. Okay, we're going to do that 15 to 20 times each side. Okay, once you've done the lateral flexion, then we're going to move into rotation. So sit up nice and straight. You're going to bring your head all the way around. Don't bring your shoulder forward. I want you to keep your shoulders back and bring your head back, your neck back to your shoulders. Okay, again, you're going to do this 15 to 20 times. Okay, then what we're going to do is we're going to take those stretches we just learned, those exercises we just did, and we're going to add overpressure and add some stretching elements to it. So what we're going to do is we're going to do the cervical flexion. So we're going to tuck your chin and bring your head all the way down. And while you're doing that, you're going to bring your hand and put it on the back of your head and give a little bit of pull. Pull forward. You should feel it pulling all the way down the back of your neck. You're going to hold that for about 20 seconds. After you do that, you're going to look up. Don't squeeze your neck back. Just kind of look up to the ceiling. Then I want you to take your hand and push up on the bottom of your chin. So look up until you come to the max range and just push a little bit. And again, hold that for about 20 seconds. Then what you're going to do is you're going to do the lateral flexion. So sit up again nice and straight. Tip your head to the side. Bring your ear down to your shoulder, not the shoulder up to the ear. Bring the ear down to the shoulder. And while you're doing that, you're going to grab with the side you're tipping your head to, you're going to grab with that hand up and grab the opposite side and kind of pull to that side. That right there will cause some stretching along the lateral of the neck and also into the spine a little bit. You can also take the opposite hand and act like you're pushing down. So like you're pushing straight down. Okay? Then you're going to do the other side. So again, you're going to do that 20 seconds each side. Then we're going to do the rotation. The rotation is a tricky one because people a lot of times have popped their own neck or tried to stretch their neck pushing on their jaw. We don't want you to do that. What we want you to do is push on your cheekbones. You're going to turn your head all the way to the side as far as you can go, shoulders back, and push on your cheekbone. And try to hold that for about 20 seconds. All right, then you're going to do the other side. Okay, after we've done the cervical range of motion, then we're going to move into what I call the chin jutting. Okay, and that helps mobilize the upper cervical spine. So what you're going to do is you're going to sit up nice and straight. Head rested right on top of your spine there, and what you're going to do is you're going to jut your chin straight out, kind of like you do your computer all the time, and then bring your head straight back. The head back, we want you to give yourself a double chin, but we don't want you to tuck your chin like this. We want you to keep your head straight up, eyes on the horizon, and bring your head straight back like you're trying to push your head into a wall behind you. Okay? So back and forth, and you're going to do that about 15 to 20 times. Okay? After you've done the chin jutting, it brings us into our final stretch, which again is you're going to move to the edge of your chair. It's called Brugger's relief position. What you do is you sit up nice and straight on your sits bones or your butt bones there. Make sure your knees are at least shoulder width apart, feet flared out a little bit to the sides. What we're going to do is we're going to have our arms hanging straight from the shoulder joints. Take your hands and take your thumbs and roll them back this way. So you're going to take your shoulders and point your thumbs toward the wall behind you. While you're doing that, you'll feel the stretching in your shoulders and the chest. As you feel the stretching in the shoulders and the chest, you want to imagine there's a hot air balloon with a string attached to your sternum that's pulling you straight up to the sky. So your arms back, chest out and up, and then you're going to do the chin jutting retraction part we talked about. So bring your chin straight back, and you're going to hold that for about 30 to 40 seconds, and then relax. You can actually kind of work through it a few times. I hope these exercises help. These exercises are not meant to be an all-inclusive list, nor are they meant to replace good ergonomics or a proper evaluation from a trained professional, but they should alleviate some of the symptoms that are associated with long-term desk work. If you have any questions or you want to schedule an appointment, my name is Dr. Jason Schlenker. You can get a hold of me at 503-908-0582, or you can find us online at westlinnchiro.com. Thank you.